how can you know what stage you're in as a patient or as their physician? What signs tell you at what stage our patient is?
It really comes down to the menstrual cycle. For women who still have their uterus and have their periods, it's really the menstrual cycle that will tell us. As for those who have had an endometrial ablation and who no longer have periods following this procedure, or those who have had a hysterectomy, then, obviously, the symptoms will guide us. We might make blood tests to measure estrogen and ovulation-triggering hormones. But it's pointless to check hormone levels for a woman who still has her periods, because periods are a hormonal roller coaster. They change from one day, 1 week, 1 month to the next. The main indicator is the menstrual cycle.
This is a crucial message to get across, because so many women ask us this before anything else. Please check my hormones. So, except for women who had surgery to destroy the uterine lining, the ablation, or had a hysterectomy, there isn't any reason to do a hormonal assessment.
There's no reason to. I know it's hard to understand, because you feel so much discomfort and pain that you feel something's wrong. We have to measure my hormones. But it won't help us help our patients. It might even make it harder to read the signs, since it varies so much. And at every stage of the cycle, hormones change, progesterone appears with ovulation. It doesn't help us help our patient find solutions to improve her quality of life. What I'd like to add, Lorraine, is that another important factor is contraception. It needs to be taken into account. Some women have no periods while using these methods. They're quite happy, and then symptoms appear. We can classify them with women who have lost their uterus. Sometimes, with these patients, we can consider to check hormones to gauge at what stage they are and see if we can take out the IUD or stop the pill. You obviously talk it through with your physician, but these are two situations where it can be useful. Thank you, Dr. Desindes, for being with us today and explaining this highly vulnerable time for our patients.